Good afternoon, everyone. Thanks for being with us here on this nice Friday afternoon, right before the weekend, of course. I've got several things to chat with you about this afternoon, and then, of course, we're going to take your questions. First up, of course, is COVID numbers. City of St. Louis is now our 7-day rolling average for new COVID cases is 125, 126 rounding up. And so that gives us a per day, per 100,000 people, a rate of 42 people per day per 100,000 people. Now, to compare that to other locations, St. Louis County is at 60, so we are they're about 50% more than we are. Jefferson County is at 92, so they're more than double. State of Missouri is at 58, so they're not quite 50% more than the city of St. Louis. And all of those numbers, I do want to say, all of those numbers are too high. But the city of St. Louis the residents and the businesses of the city of St. Louis have been doing a good job of following the mitigation strategies, mask wearing, hand washing, social distancing, and keeping your groups small. The smaller the better. Ideally, just your own household. We know that's very difficult, but certainly that's something that you would want to practice for sure if you have any sort of underlying health condition or if you're older. So city residents and city businesses have been doing a good job, and that's why our numbers are by far the lowest in the region. That said, we regionally, when we look at the hospital numbers, yes, this is 2 days old, so this would be Wednesday's numbers. There were 900 people in the hospitals regionally, and this is the hospitals that are in the pandemic task force, which are the four major systems. 900 people that were in the hospital that were confirmed COVID positive, and another 97 people who were suspected. So in total, about 1,000 people in the hospital. That's down a little bit from where we were earlier in the week and from where we were last week before Thanksgiving. It's not down enough that you can let your guard down at all, but at least the hospitalization number is a little bit better, is the way I would say that. 186 people who are in the hospital are in the ICU at the hospital, and 125 of those people are on ventilators. Patients admitted to the hospital 2 days ago was 113. So the 7-day average for people being admitted to the hospital is 111. And on the good news side, 2 days ago there were 164 people discharged from the hospital. Now, we know that with regard to COVID cases, there was a bit of a lag of reporting over the roughly 4-day Thanksgiving holiday, and so by now we think most of that reporting has caught up. We'll know that for sure as we go into next week and continue to get those numbers. I think also, and this is anecdotal, but the more and more that people have really become conscious about how much of an increase there was and there is in the numbers, people are shaping up a little bit in terms of mask wearing and social distancing and keeping your groups small. And I that has to be commended because it is frankly the only thing that is going to get us from where we are now to where we will be in 3, 4, 5, 6 months with widespread vaccination. So we're not there yet. We're very hopeful on these vaccinations. And we know that by the end of the month, there will be some vaccinations that will be here, vaccines that will be here in St. Louis and available first to healthcare workers, and first responders, police, fire, EMS, corrections officers. So we know that we're getting there, but please don't let your guard down. I mean, these numbers are terrible. The hospitals are more or less full, and the normal emergencies continue to happen. Of course, heart attack, stroke, appendicitis, broken legs, whatever, all the things that send people to the emergency room on any day, on any normal day when we're not in the midst of a horrible pandemic, well, those things are still happening, and so hence the hospitals are full. I give you just I'm telling you a little bit of good news. Things look a little bit better, a tiny bit better. But as a precautionary, out of an abundance of caution, I'll say, the city has just set up its temporary morgue again. That is a location that would handle about 50 additional deceased people. We don't need it right now, and we hope that we never need it. But our morgue in the city holds about 60 people, on any day. We have a lot of people always in our morgue. Not full by any stretch of the imagination, but we don't want it to get to that point either. So we have set up this temporary morgue. Very serious. I hope, in a month or 2 months or 3 months, somebody's saying to me, well, why did you waste the money on that? Because I'll be happy that, if that is the situation, that we don't need it. I will tell you that in the month of November, in the city of St. Louis, there were 25 deaths from COVID. Give you a little bit of comparison. Go back to May. There were 65 deaths in the city of St. Louis from COVID. So our numbers are better. We were as low as 12 during the month of September from COVID. So gives you a little bit of perspective. Early on, many more people were dying of COVID. And of course, the treatments have been, are better now. We know more now. The doctors and nurses, medical professional knows more now. But also, a lot of the people who are very susceptible to dying from COVID are older people over 60 or 65, many of whom do have underlying health conditions. And they have really taken to heart the message, which is, you've got to follow these mitigation procedures. So we had 25 deaths in the month of November. But out of an abundance of caution, we did set up a temporary morgue that would hold 50 people. And hopefully we don't need it. So that's on a pretty serious note to end this week on, but I think it's important that you know that. I've gotten a lot of questions. In fact, I got a call the other day from someone who said, will you be able to lift the bar and restaurant closing time, which, as you know, is now 11 p.m. Will you be able to lift it for New Year's Eve? And it's very unlikely that the 11 p.m. closing time would be lifted before New Year's Eve. I mean, I'm sorry to say that, but just very unlikely, based on what we see right now. So I think what we're looking at here for Christmas, New Year's, is we are looking at a situation very much like Thanksgiving. Very small, hopefully your own family only, get-togethers and celebrations. I'm sorry to say no Christmas parties, no revelry for this Christmas. If I'm wrong, great. I hope that I am. But at this point, I think, and I met with Dr. Eccles this morning. We talk almost daily. sometimes more than once a day. And we both agreed that we really do need to put the message out to folks that although we hope our numbers are better by the end of the month, it's very, very unlikely that they'd be good enough that we'd be able to lift the 11 p.m. closing time on New Year's Eve. Sorry to say that. But you can just, pretend like you're in another country and celebrate early if that's what you'd like to do. So, what else today? Oh, I know. Switching subjects a little bit. So, Wednesday night, early Thursday morning, actually about 12:30 in the morning, we had an officer shot. And, the good news is he will be okay. He was discharged from the hospital. Wasn't a life-threatening situation. But that is the 10th police officer that has been shot since the 1st of June. That has never happened before, that anyone can remember. And, officers are just out there responding to what should be a routine call. There's no such thing, by the way, as a routine call. But a routine call for a disturbance, and arriving on the scene and just getting out and assessing the situation, and all of a sudden see the flash of a gun or muzzle, and ended up being hit here in the throat with what was described to me as probably shotgun pellet. Thank God it wasn't worse. But 10 officers shot since June 1st. And as you know, of course, we also had a retired captain who was shot and killed. One of those, so that was one death. One of the 10 officers, Officer Bohannon, was killed 2 months ago. And officers have never been under more fire. And so in addition to the 10 officers that have been shot, there have been a couple of dozen officers that have taken fire, that have not been hit, but that have been fired upon. So I just want to say, first of all, thank you to all the police officers who do a very tough job. The environment that we're working in today is very, very difficult for them. And so thank you to them. And those of you who, hopefully all of you will keep that in mind and thank an officer when you see them. This is a very tough situation for them, but to have 10 of your coworkers shot within the last 6 months takes a toll. So thank you to all the officers. I think that's all I have. Do we have questions?
A couple of questions come in today. So one of the first questions has to do with quarantine guidelines that the CDC is changing. Mm-hmm. Has the City of St. Louis Department of Health decided to follow suit, or are they staying with their existing guidelines right now?
Right now we're staying with the existing guidelines. Those came out a couple of days ago. They were reported in the news first. We're looking at that, but honestly, this is not the time, in my opinion, to ease up on things. If you've been exposed, or you believe you've potentially been exposed, at least as of today, we're still saying, quarantine for 14 days from the date of your last exposure. And sometimes that was 2, 3, 4 days before. But we are not changing our guidelines at this point in time. Our numbers are good for a reason, we think. So.
A couple of folks have asked if we should anticipate any additional capacity restrictions on all sorts of businesses in the city.
So that's something that we're taking under consideration. First, let me say, and you may know this, that the Joint Board of Health and Hospitals yesterday asked us to consider whether or not we should go to 25% occupancy. We're currently at 50% for bars and restaurants and large venues. And more important than the percent, though, right now, and has been all along, is the requirement to stay 6 feet apart. It is the social distancing, because if you had a 50% or a 25% occupancy, but you were all huddled down here in this part of the room, well, that wouldn't do any good at all. And so what we're thinking through here is, can a business even open if they can only do 25% of their capacity? Can they even afford to pay the rent, keep the lights on, and have a staff there? And we've been trying to take a very balanced approach in this, which is to keep businesses open but keep people safe from COVID by enforcing social distancing, mask wearing, and we've done a good job of that. I mean, unfortunately, there are a few businesses that have not been willing to enforce those regulations, mask wearing and social distancing, and when that is the case, then we do give them a warning, and eventually, if they don't come into compliance, then they are shut down for a period of time. So we are approaching it in that way with enforcement of those that are not following the rules. There isn't, as Dr. Will Ross said yesterday, there isn't data that supports further closing bars and restaurants, and to put that just on one industry, an industry that has already been devastated and where there are lots and lots of people who are unemployed, is a difficult thing. So it is something that we're looking at. One of the things I guess that I would point out here is our numbers are better than anybody's numbers in the region. They're still not good enough, but when you're 50% less than other areas in the region and of the state, then I think that we're trying not to layer on new rules and new rules. We're trying to get compliance with those rules that are in effect. It's not something that we've ruled out, but very difficult to enforce percentage, 25%. So we're thinking about it.
So a question on existing guidance and restrictions on what we already have.
Okay. Sorry.
Patty had a question about requirements for restaurants and businesses. If they have a positive case of a staffer or one's traced there, are they required to close and conduct cleaning?
Well, sorry guys, I'm gonna sneeze there in a minute. So if someone is positive, is that business required to close?
And do cleaning.
And do cleaning. The business is required to do cleaning. Whether they have to close to do that is another subject. Maybe they would do it overnight. Maybe they do it in the morning. So they are required to do cleaning.
Okay.
Mm-hmm.
Okay. So we have a couple other questions related to COVID. A lot of concern about Thanksgiving. Has the city of St. Louis and or the region seen that spike that everyone was warning against if too many people got together on Thanksgiving?
We're probably seeing it now, but it's not over. You get a 14-day incubation period. So, by this time next week, we'll be over it, we would think.
We do have a question about vaccines, Mayor. A question about how the city and the Department of Health are coordinating with the state to get the vaccines distributed by the end of the month.
So, the state will get vaccines. The federally qualified health centers here will get vaccines. There's a very elaborate logistics initiative underway to make sure that the vaccines get where they need to be. Hospitals will also get vaccines. So like the testing, the city's allocation will be through the federally qualified health centers. And we are figuring out when we get them what is the best way to roll them out to the city employees who are first responders. And so they may go to the federally qualified health centers, or maybe the federally qualified health centers would go to them in a way to get a number of people done at one time. That's all still being worked out. But this will be a logistical challenge, of course, but the the vaccines are not all coming at once. To the state of Missouri, there were, this information about 2 days old, 51,000 of the Pfizer vaccines were coming, and then 105,000 of the Moderna vaccines were coming, and then another 60,000. So they're coming out in batches because, of course, they've got to cover the whole country. And, that's why it will take several months, maybe 3, 4, 5 months before they are available widely to the public, because there is some stratification of who gets it first. Healthcare workers, first responders, congregate living facilities, nursing homes, that sort of thing. So,
John's question is, what kind of change do you need to see to go in the opposite direction and begin to allow businesses and establishments to lift restrictions? And when might that take place?
well, John, I don't know when it will take place. That really depends a lot on, right now there's a lot of community spread. We set some metrics couple of months ago that when average daily hospital admissions, 7-day average, is 40, that would be, and along with that you will see new cases being down as well, but is 40, then that would be when we would begin to lift restrictions again. To give you some perspective, I think I have this here. Average daily hospital admissions, 7-day average right now, is 112. So that would require a major improvement in the numbers. And if we can keep people wearing masks, social distancing, if we can, keeping their groups small, if we can keep them doing that, and at the same time begin rolling out the vaccinations, we should be able to see some good progress. But I don't know when that will be. You may not have been on earlier where I talked about, and I don't know if you're talking about bars and restaurants or not, but I talked to somebody, called me the other day and wanted to know, well, can you lift the 11 p.m. closing time for New Year's Eve? And I said, probably not. So I doubt that this is, that we're down at that level by the 1st of January. I hope I'm wrong, though. So.
A few folks have asked about what is the game plan, or what happens when we reach a point, if we reach a point when our hospitals technically become full or cannot take additional people.
Well, the hospitals have talked about that a lot. Dr. Garza, who heads up the pandemic task force, has talked about that a lot. And, that of course is a huge worry for them, because they then, the doctors and the nurses that are in the hospitals working, will have to make the decision as to whose needs to address first. Is it a young person's? Is it an older person's? What they will have to assess who has the best opportunity for them to really help and recover. So those decisions will be made in the hospital if it gets to that point.
We have other topics for our last 5 minutes. One, David is watching and has asked for an update about the tiny home community village and when it will be presumably ready for occupancy.
Did the lease get signed?
It did.
Yesterday, right?
Mm-hmm.
Okay, I thought so. So, good news. The lease on the property was signed by the comptroller yesterday. And so that means today, and there's a long list of things that are being done. Utilities are being connected, and the site being readied. And so, 25 of the tiny homes are ready now. And so we'll have them up, and some of them up anyway within the next 10 days. I'm going to say. Believe me, as soon as there are a few of them in, you'll hear about it from me, because I'm very anxious for that to get started.
And maybe the last question for the day. On the officer you mentioned, Mayor, who was shot the other night in the line of duty, the 10th one. We have a question about what happens when the state has very lax gun laws. Do you think, with so many officers hurt in the city this year, that it's time that the state or the governor do something to help us on that front?
Well, I absolutely think it's time. It didn't just get to be time, it's been time for a long time. I think in the city of St. Louis, we should be able to have, that you should be required to have a permit to carry a gun. And if you are required to have a permit, like you used to be, up until 2017, you were required to have a permit, but that law went away. And so now, there's no permit required, no training required, no background check required. Anybody can carry a gun anywhere, anytime, and there is no doubt that that makes the situation more dangerous for law enforcement. So yes, I'd like to have, in the city of St. Louis at least, us be allowed to require people to have a permit to carry a gun. It's hardly a hardship. You have to have a driver's license, you have to have a license plate on your car. So yes, I would, I'm very much in favor of that.
That's all of our questions for today.
That's it for today. Thank you all for being with us. I appreciate it. I hope everybody has a good weekend. And we'll be back and talk to you next week. Thanks.